We are a little bit late today, this morning, but you know how it is in Grenada. Today we're talking with Dr. Sebastian Peters. We been to Dr. Sebastian Peters twice before. And the first presentation was very blurry, so we had to delete that. And we had a second chance of doing our interview with Dr. Sebastian Peters. And again, we had some trouble with Wi-Fi. So now we're in my house. Wi-Fi is here. So we're going to talk to Dr. Sebastian Peters. And this brother is very cool in the endocrine system. He's a doctor of the endocrine system. But he does a lot of refreshing courses. So there's new information coming out on a regular basis. And he's going to tell you what they are. Well, we're going to talk about the glands. He's going to mention about the pituitary gland especially, and PCOS in women. And we're going to talk about all these conditions that affect lots of our people. And we had a few people who had pituitary tumors. And I asked them to go to Dr. Sebastian Peters. There's a lady who had one also, and she's doing pretty good now. So that's telling you that this brother is very effective, okay? But Dr. Sebastian Peters, welcome.
Thank you.
First
Sorry
off,
for being late.
That's okay.
I'm the one causing to be late.
I'm always late too. First, I want you to give everybody your email address.
Okay. S-A-M, Sam.
S-A-M?
S-A-M. A as apple, X as X-ray, E as evergreen, SamAx at AOL.com.
At AOL.com. So SamAx at AOL.com.
That's it.
A-X-E.
Mr.
Sam, yeah, you're big axe.
Yeah.
Okay, a little history about yourself. You know, I know you're trained in the endocrine system, so you are a doctor of the endocrine glands.
Yeah, well.
And we don't have one over here. You're the only one at base here.
In Grenada.
Yes.
In the OECS in particular.
Yes.
I went to University of West Indies Medical School, then specialized in internal medicine in Canada and after UWI, and then did fellowship in endocrinology at State University of New York, Young State Medical Center in Brooklyn, and practiced 25 years in New York, then 14 in the Bahamas, and I'm back in Grenada now, 2 3/4 years.
So you've been living in the Bahamas also?
Yeah.
So you
I was married to a Bahamian.
Oh, okay. So you were practicing over there?
Divorced now.
You're divorced now?
So I'm back home.
That's all right. That's part of life, man.
Yeah.
All right. So you have a lot of training.
Yeah.
And I noticed that
every year I go to the Endocrine Society meeting.
Right. Because
41 years. The last one last month in Orlando.
Right.
Was 41 years without missing.
So you're always refreshing.
Yes.
Because
things change. The half-life in medical knowledge probably now is about 1.5 years.
Okay, so new things happening all the time.
Yeah, the stuff that I learned when I graduated in '69, if I were to be practicing that now, there's a lot of people would be, crossing over the River Jordan in a speedboat. Those things are outdated.
Yeah, they're outdated, and that's what I'm saying. A lot of doctors don't do refreshing courses. And that's the negative part of lots of our doctors in the Caribbean country. They don't refresh. They feel what they learned from 1960, 1955, that's it. And there's nothing new. But there's always something new coming out. And that's what I like about our brother here. He's always refreshing. And I learned a lot about it. I learned a lot from this doctor on the endocrine system, because we had a TV program together. Yeah. On the endocrine system already, right? And I have an idea how the endocrine system works, but Dr. Sebastian Peters is cool in that area. So we are going to get into depth and show you pictures and how you have troubles and get tumors in the pituitary gland, and why women get PCOS and all these different conditions that affects a woman's reproductive system, right? Before we go to that though, I'm in New York on Sunday, the 21st. And the people who didn't get the CMOS, you have to understand that Grenada is a small place. I said that before, and I'm saying it again. Where the girl is shipping the CMOS from, in the countryside, the post office is not taking the CMOS. So she have to transport 60, 80 pounds of CMOS, and she have a transportation to come back to St. George's to go into our main post office to post the CMOS. That's a lot of work. Number two, the CMOS cost $28 to $30 to post out. Plus, they want us to package it in a certain way. We can't bring it in boxes. So you have to understand and be patient, because a lot of people doesn't understand that we're not living in America where we have UPS and we have all these carriers. We have to do it ourselves, so it's very difficult. So I called a few people who didn't receive the CMOS, and I'm working with 100 pounds of CMOS on Sunday. So all the people named that we have that did not receive the CMOS, I will post it within America, where it's going to be faster and you won't have to complain. All right? If you can't wait till next Sunday or Monday, you can go to the PayPal and you can get your money back. That's bottom line. Because we don't want to hassle. We don't want people to say, oh, we this and we that, because we don't harm anybody. All right? And again, Facebook is not a place for us to fight and wars. Facebook is an avenue for us to display our ideas. You understand? It's not about fighting and cursing, and it's not about that. It's about sharing ideas with each other so we can learn from each other, because each one teach one. Okay? All right? Now we're going over here, Dr. Sebastian Peters. Now, this is the endocrine system, right?
Yes.
So I want you to explain to the people one by one how they work. Because before you go to the thyroid gland.
Yeah, well, let's start with the main
one.
The headquarters.
The headquarters.
Yeah.
You call it the headquarters.
Yeah, the hypothalamus, which is the continuation of the brain, the bottom part of the brain.
Mm-hmm.
That's the master gland that controls the whole endocrine system.
Right, that's the master gland of the endocrine system.
Yes.
Right.
In the olden days, it was felt that the pituitary gland, which is this gland here,
Mm-hmm.
that's the anterior pituitary
part,
gland,
mm-hmm.
was the master gland. But again, as you mentioned earlier on, as we progress, we get new information, and it's proven and so forth. Mm-hmm. The hypothalamus as the master gland was proposed by a world-famous neuroendocrinologist, a physiologist named Jeffrey Harris.
Okay. Hold on a minute. Can you all see good? And can you all hear properly? Let us know, because we had trouble the last one with blurry vision of the pictures of the glands. So if you all can hear and if you all can see properly, just let us know. Put a yes below the post so that we could at least serve you a little better, okay? If you cannot hear Dr. Sebastian Peters, let us know so you could talk a little louder, okay? Wonderful. Blessed. What is saying there, Major? Can they see? Okay, wonderful. Okay. That's right, Dr. Sebastian Peters, you were saying that.
It's okay?
Yes, it is.
Yes, Jeffrey Harris, because you got to mention him.
Mm-hmm.
He was the one who thought about the hypothalamus being the master gland.
Right.
1, 2, 3 different people got Nobel Prize. Unfortunately, the Nobel folks, they do not award the Nobel Prize posthumous.
I got you.
So it was his idea, and 2 and 3 other people worked on it, and they got Nobel Prize. So the hypothalamus releases what we call releasing hormones. Releasing hormones.
That's what the hypothalamus does. It releases hormones.
Yeah, no, but the hormones are called, we all know about the anterior pituitary. That's been known a very long time. Mm-hmm. Thyroid stimulating hormone comes from the pituitary.
From the anterior part of the gland.
The anterior, yeah,
right,
because
okay.
The posterior, that's important.
Right.
The posterior pituitary, even though it's very close to the anterior pituitary, they're completely 2 different organs. Even though they're in that small area behind the eyes that we call the celotersica in the skull, they're completely 2 different organs.
Right, but let me ask you a question though. The anterior part of the gland have a lot to do with the other glands.
No, the anterior is the main thing. I'll mention the posterior pituitary.
Right.
Because the hormones coming from there.
Right, but there's some that deal with water. Isn't that so?
No, that's the posterior
That's
pituitary.
the posterior part, right? That's what I'm saying. Right.
Yeah, oxytocin and vasopressin.
Right.
Those come out from the nerve endings of the hypothalamus and the end in the posterior pituitary.
I got you.
The anterior pituitary has thyroid stimulating hormone, gonadotropin, releasing hormone. Gonadotrophin hormone, FSH and LH. We just call them gonadotrophin hormone.
Right.
The releasing hormones come from the
right.
hypothalamus.
So let's go on slow.
Corticotrophin, releasing hormone.
Right.
Corticotrophin, ACTH is in the anterior pituitary. Prolactin, growth hormone, they're all in the anterior pituitary.
Right. Now let me ask you a question now. Now in the anterior pituitary gland, right? Because I just said you mentioned LH and FSH.
Yeah, those are the gonadotrophin hormones.
Right. Now if the pituitary gland do not receive that signal, as you said, from the hypothalamus gland, what happens to the pituitary gland normalizing a woman's luteinizing hormone and follicle-stimulating hormone?
Okay, no, the whole feedback system, let's deal with the FSH, LH, or the gonadotrophic hormones. Depends on the ovaries, where's the ovaries? They're the ovaries here.
The ovaries, right, can you hear me, Joe? The ovaries.
This is the ovaries. The ovaries will send out estrogen and progesterone. And there's a feedback system which goes to the hypothalamus and also to the pituitary.
Right, so there's a feedback system from the ovaries that go back to the hypothalamus and then back to the pituitary gland.
Yeah, so the control is a feedback system. So if for any reason something goes wrong with the ovaries or they're not synchronized, you'll get, it goes back to the hypothalamus. The hypothalamus tries to correct it as best as possible. So the feedback system is very important. So the ovaries, the pituitary and the hypothalamus, they work together with the feedback system. That's what controls. And in PCOS, as you mentioned, PCOS is one of the main problems, is an anterior pituitary and hypothalamic problem, not just an ovarian problem. Years ago, they thought it was the PCOS was due to primarily an ovarian problem.
But it's not.
That's not the
All right.
truth. This is why, again, you have to keep up, because
you have to keep
a lot of
refreshing.
Yes, because a lot of things that you thought that they were written in slate or in stone. That's not true, because you find out that things change and there's more research going on daily. We get more knowledge.
Right. So what you're saying is let me just come over here. The ovaries and the anterior pituitary
and the
hypothalamus, if they're not in balance, a woman could have troubles in the reproductive system.
Yes, and they have, if something goes wrong in any one of them, there's a problem. Then the system goes in balance, even though that's not a word I like to use. Imbalance. A lot of my colleagues, when they don't know what's going on, they say there's a hormonal imbalance. Right. I don't know what that means. That's too generalized. One has to be more specific.
So you don't believe in talking about imbalance in the hormones?
No, because
especially if they go to a gynecologist.
No, because you need to explain to the patient what's going on when you say you have a hormone imbalance. That's too general. That's like, the sea is blue or, whatever. That's, you have to be more specific.
But I don't think that the gynecologist is trained in this area.
No, they should be.
But it should be. And that's and that's the reason why they could tell a woman that she's in balance.
Everybody, as a medical student, you are trained in all of these. Of course, as you specialize, you gain more knowledge and you go deeper into it.
Right.
But even the general practitioner, if he tries to remember what he wants, a lot of people, unfortunately in medicine, is regurgitation, meaning that people go, they cram, they memorize, and then they regurgitate or vomit, to put it, grossly, the stuff. And if you don't think, because the bottom line is that you got to think, you will not understand the endocrine system, because you cannot just regurgitate. There are too many things in too much biochemistry and physiology that you cannot just go cram it, swat it, memorize, regurgitate, and that's it. But unfortunately, a lot of my colleagues because they have to pass the exams.
They have to pass the exams.
And
wow.
then afterwards, meaning that they did not understand the proper functioning
of the endocrine system.
So this is why you understand when I say I do not use the term
Imbalance.
hormonal imbalance. I will tell you that your FSH and LH and they're not working properly, they're not in sync, or something like that. The thyroid is, what a general term, you have a hormonal imbalance.
That's
People
not,
get, that's like,
I understand.
I do not like to hear that
I
term.
understand that.
Okay.
No, let's go back to the gland over here, the pituitary gland, right? Now, you just mentioned a while ago that the anterior part of the gland deals with a woman's LH and FSH.
Yeah, and also with the men.
The men's too, right?
Yeah, men.
Right.
This deals with the FSH, LH.
Right. Men's reproductive system also.
Yeah,
that I believe.
same one, except
Right.
the men we have the testis.
And that's it. I think that is the front part of the gland, if I'm right.
Yes, yeah.
Right. The rear part of the gland is the posterior part,
pituitary.
posterior pituitary, right? And I think that part of the gland deals with the kidney. Am I right or wrong? In terms of the water balance.
Well, not only the kidneys, but it also deals with reproduction, the uterus, pitocin, oxytocin, cause contraction of the uterus,
right,
in labor and so forth. And new things just coming out a few weeks ago at the conference. Oxytocin, vasopressin, they're basically the same with just 1 or 2 amino acids, structural differences.
Right.
But they play a big part in mental development and so forth, and psychological development.
So that's the posterior part of the gland.
The posterior.
The posterior part, sorry.
Yeah, the posterior, which is the ending of the hypothalamus, the nerve ending.
Right.
So this is where, it's shown in animals, mammals, that the mammals, the fetus, the babies that get more attention from the mother, they're psychologically better able to face stress and so forth. So that's new, but it's very important in behavior. So it's not just with water balance, as you mentioned.
It's a lot of other stuff.
A lot of other stuff, because there's a diabetes called diabetes insipidus. That's if you don't have enough vasopressin.
Diabetes.
If there's some damage.
Diabetes what?
Insipidus.
Insipidus.
INSIPID.
Oh, insipidus.
Insipidus.
Right.
Yeah,
Okay. Diabetes insipidus.
One should never say diabetes alone. I mean, diabetes mellitus, which is sugar.
Right. The sugar.
Right. Sugar diabetes.
Right. And then diabetes insipidus.
Insipidus is the water where the person passes. They'll urinate like they pass.
Like crazy.
Yes. Lesions, and they have to. That's if they get damaged. So when you mentioned the posterior, dealing with the kidneys, that's true. But also there are a lot of other things. It deals with vasopressin, can stimulate ACTH or the cortisone setup.
That's
It's a complete interaction between all the hormones, in the immune system also.
And that's why you mentioned that the hypothalamus gland is the master gland.
It is the master gland.
Now let me ask you another question. Now the anterior part of the gland, the anterior part of the pituitary gland.
Yes, anterior pituitary.
Right, anterior pituitary. I want to mention what you mean because I like to follow what you say. Now it have a lot to do with the thyroid gland.
Yes, it has thyroid stimulating hormone.
Right. So it produces TSH.
TSH, yeah.
Right. Now that feeds the thyroid gland.
Yes, that stimulates it.
Right.
Thyroid stimulating hormone.
So once the pituitary gland do not feed the thyroid gland, TSH, what happens to the gland? Does it affect the parathyroid?
No, the parathyroid, the relationship to the thyroid is just that they're close to the thyroid. The parathyroid control calcium metabolism. These little, you see, 1, 2, 3.
Right, that's the parathyroid gland right there. Right.
Yeah. But the parathyroid, the only relationship to the thyroid is anatomical, the location.
Right, of the parathyroid.
Yes.
But
they're not, if calcium, something is wrong with the calcium, of course.
Right.
It can affect
the
whole body.
Right, because the parathyroid metabolizes calcium, isn't it?
Yeah, they control calcium.
They control calcium.
Yes,
right.
They control calcium.
So the pituitary gland, the anterior pituitary, releases what we call TSH.
Thyroid stimulating.
That feeds the thyroid gland.
Yes, that stimulates the thyroid.
And if that don't happen, what troubles can you have? Can you have in the thyroid gland?
Okay, well, you have a lot of autoimmune diseases that where the body treats the thyroid as though it's a foreign substance.
I think they have one called Hashimoto disease. Is that one of it?
Yeah, you have Hashimoto's, but the general stuff is Hashimoto's a Japanese doctor who will describe one part of it. But you have autoimmune where antibodies are formed. That's the better general term. Because some of the antibodies will stimulate the thyroid and get an overactive thyroid, and some will destroy the thyroid, and that's the more Hashimoto's type disease.
So some of the antibodies will get into the thyroid and stimulate the thyroid gland.
Yeah, that's Graves' disease.
That's Graves' disease, right? Okay, and then that will
Graves
cause.
again doesn't mean the disease is Graves. It's Dr. Graves from Ireland.
So they give the disease after a doctor.
Yeah, after the name.
I got you. So then, if the antibodies escalate into the thyroid gland, it could also destroy the thyroid gland.
Yeah, well, the majority, most antibodies will destroy. But the ones that stimulate, that's a whole new immunologic reaction where they stimulate. That's the only situation in biology where antibodies stimulate the receptors instead of destroying them.
Well, stimulates it.
Yes, instead, that's the only immunologic reaction where an antibody, instead of destroying the receptor in the organ, it stimulates it.
Now let me ask another question now. Now, if you have troubles in the anterior pituitary, right? And it affects the thyroid gland in a negative way.
Yeah, well, it will not produce TSH.
Right, it won't produce TSH.
If there's a pituitary tumor,
right.
If you got bleed into the pituitary gland, and it can compress the TSH and all the others, FSH, LH, and you can get a problem, so the thyroid will be under-functioning.
Because I sent a patient to you who had a tumor on the pituitary gland. And the question to you is, what caused people to have tumors on the pituitary gland?
Okay, well, it's genetics, hereditary, and also viruses, I believe, can cause
viruses.
Viruses.
Wow.
Can cause tumors in the pituitary gland, and also higher brain dysfunction in the hypothalamus and even higher can cause pituitary tumors.
So, if there is a problem in the hypothalamus gland, where it's not feeding the pituitary gland properly, can a tumor develop because of that imbalance in the pituitary gland?
No, what usually happens is that the pituitary will underfunction.
It will underfunction?
Yeah. Common is a tumor in the hypothalamus or disease sarcoidosis, which can, be in the hypothalamus, and that will interfere with the transmission. Again, let me just explain that the hypothalamus and the anterior pituitary, they're not connected. So the hypothalamus has to release what we call the releasing hormones into this plexus of blood. We call it a portal system. So the releasing hormones go into the bloodstream and get to the anterior pituitary.
Oh.
Because they're not connected.
They're not connected.
I told you the posterior pituitary with the nerve endings of the hypothalamus. They sit in the same little cellular tubercle, but they're not connected. They came embryological from two different places.
Oh, got you. All right. So a lot of people who have saccharidosis,
They can either have it in the central nervous system. Yeah, it can interfere with.
Wow.
We always have to look to rule out sarcoidosis.
I got you. All right. So now let's go to the pituitary gland and the anterior part of the pituitary to the adrenal glands.
Right. That's the cortisone.
The cortisone.
Yeah.
Right. This adrenal gland right here.
This is the adrenal
Right.
gland here. Yeah. So the pituitary produces ACTH, which is
ACTH.
adrenal gland
Right.
stimulating hormone.
That's from the anterior part of the gland.
That's the anterior.
Right.
And the hypothalamus produces CRH, which is corticotrophin, or the other word for ACTH, releasing hormone. It comes down, into the portal blood system, stimulates ACTH, and ACTH will stimulate the adrenal to
glands.
produce cortisol.
Cortisol. And I think the adrenal have two parts. One is called a cortex, one is called a medulla.
You got it right.
Right.
The cortex produces cortisol and other like sex hormones too.
Right, like DHEA.
You know, yeah, DHEAS and so forth. The medulla produces epinephrine and norepinephrine, which is different, is not under the control of
Not under control of the pituitary.
anterior pituitary.
But let me ask you a question though. Now, can you have troubles in the pituitary gland that affects the adrenal glands or vice versa and have mental disorders?
And have
Mental disorders.
yeah, well, people who have what we call Cushing syndrome or hypo too much cortisol, they can get there's a vague line between severe depression and the psychotic depression. So
Psychotic behavior too.
yeah, so you can get it. It's not that common, but you can get it.
You can get it.
Yeah.
All right, and that's because of the
Excess cortisol.
Excess cortisol from the gland, from the pituitary from the
Adrenal
adrenal
glands.
glands. Now let's go to the pituitary gland and the pancreas, which is also a gland because part of the endocrine system, right? Now
There's the endocrine part.
the endocrine part.
And
No.
pancreas,
So
you have two parts.
right, two parts, endocrine and exocrine. Now,
Yes.
now, how does the anterior pituitary feed the pancreas?
Okay, this is very new area, but it's believed that dopamine, which you know is what controls prolactin. Prolactin is an anterior pituitary hormone, which is important for lactation,
Right,
development
breast.
of the breast, and so forth, and breastfeeding. And it's believed that dopamine, which is from the hypothalamus, has a control over the pancreas.
Over the pancreas.
Yes. But you're going into areas that are very new, and you know, a lot of the stuff has not been completely established as yet. But they do have an influence.
I got you. They have an influence, and the pituitary gland to the pancreas. Now you
To the
meant
endocrine-
the endocrine system.
The endocrine pancreas.
Pancreas. Okay. With the endocrine part, that's the part that produces insulin.
That's a part of yes. That's
Right.
the beta cell, and the
Right.
alpha cell produce glucagon.
Right, and the
The delta cell produce somatostatin.
right, and the exocrine part of the pancreas produces enzymes.
Yeah, that's for digestion.
Digestion. Now, you just mentioned prolactin levels, and I was just talking to a lady who had a high prolactin level of 120. Now, the doctor she's dealing with couldn't get it done, right? So no, they can't. They said she can't because she's been taking a drug for almost 2 years. It's not going down. No, so my question to you is this: if a woman have a high prolactin level, and a high prolactin level could also contribute to troubles in the breast.
So,
Troubles in the breast.
no, with the hypolactin level will cause menstruation to cease. And even though the woman is not pregnant, milk can come from her
the
breast
breast,
and so
right.
forth. But when you mentioned it can bring it down, either the patient was not taking, you know, some people don't take medication properly, or they didn't go to the correct dosage, or either that the medication was no good, the generic was no good.
That's
So
the
there
reason
was
why.
the three things. So it's either the person was not taking it as she should, the medication was not at the right dosage, or the generic medication was useless.
And that's the reason
So
why.
that will be the reason. So there's no other reason it wouldn't come down.
Because once you have balance in the anterior pituitary and the hypothalamus gland, a woman not supposed to have a high prolactin level. That's what you're saying to me.
Well, but see, the hypolactin, that's the most common anterior pituitary tumor, what we call prolactinoma.
Prolactin what?
Prolactinomas, meaning that prolactin producing tumor. That's the
So the
most
prolactin, so a high prolactin level can produce tumors too.
No, the high prolactin levels come from the tumor
Okay.
of the cells
Of the
that
cells.
produce, we call them prolactin producing cells.
Or prolactin producing cells. Okay.
Right, and those were, when you asked me the question, I said, could be dysfunction in the hypothalamus with some hereditary input, or some other people believe that viruses can cause, we call oncogene viruses.
Oncogenes.
So yeah, they can cause tumors of the, to grow.
In that area there. Okay.
Because one of the, this is a time for me to explain. In the early 70s, the prolactin producing tumors, or prolactinomas we call, the microadenoma means it's less than 10 millimeters or 1 centimeter, and the macro means it's greater than that.
Right.
The surgeon who from named Jules Hardy from Quebec, Montreal, he went and he did, that's, those of you who don't remember, that's French part of Canada. And he did a fellowship in pituitary surgery in France. And he came back, this is when I was early doing endocrinology. He was removing the microadenomas in the ladies in Quebec. And which was good because Canada has socialized medicine. So he was able to do that. These ladies were cured, they were able to have babies and so forth. But I remember 10, 15 years after, when I was affiliated with State University of New York downstate, we had a lecture, I don't remember who was commemorating somebody's name. And a lot of these tumors, these ladies, and who Jules Hardy had operated on, the tumors came back. He had removed them. So this is why we believe that it's a result of dysfunction in the hypothalamus and even higher up in the brain.
In the brain.
That causes layers surrounding the environment for the development of the prolactin producing tumors.
Oh, I got
so
you.
That's what, because they came back. So now the treatment for this is not surgery, it's medical, is to use the pills. That's what I'm saying.
Not surgery at all.
No, except it's so big that it's causing
trouble in the
compressive symptoms.
Okay.
Yeah.
All right. No, let me ask you a question though. How important is the digestive system to the endocrine system?
It's very important.
We're going over here now. How significant? I'm over here. Come over here, Dr. Martin Peters. Now, how important is the digestive system to the endocrine system?
Yeah, well, again, that's new. One of the things that came out in the meeting is that what is called a microbiome. Every person, every healthy person, has trillions of bacteria in their gut.
Down here?
Yes, that's
in the
in
intestines.
the gut, which they're very important for the functioning of the body. Very, very important for the functioning of the body, even in false behavior too. So one of the things, again, I think I mentioned that to you before in the program, when you use antibiotics for people getting antibiotics for virus, which is not, viruses cannot be killed by antibiotics.
Antivirus
the
stuff.
regular antibiotics. You have a cold or something like that, what you need to do is take a lot of vitamin C, like mega doses, and that will shorten it.
I believe
Antibiotics do not. All they do is kill the bacteria, the good bacteria, and patients get sick. Women will know because the majority of women, because in women, there's bacteria in the vagina, which has what we call a symbiotic relationship, just like the trillions in the gut. And if a woman were to go to a physician and she gets an antibiotic, it will kill the friendly bacteria and allow fungus and other stuff to go.
Inside
here? Why in the woman's vagina.
In the vagina too.
Yeah. So this is why I know using, as I mentioned before, when I was a little kid and we were given vermifuge, castor oil, and all these things before you go back to school, I knew that was criminal, even though it would have been 5, 6, 7 years, and there's no validity in medicine. all you're doing is destroying the friendly bacteria.
What about probiotics?
Hmm?
What about
But
probiotics?
probiotics are
Put it back.
probiotics are bacteria.
Yeah.
You know, they try to identify some of the friendly bacteria, and they put it back in probiotics. So a lot of the probiotics you use, I think they're putting them in
Yogurt.
Yogurt.
Yes. But that don't have a lot.
Will have
We don't go by that.
friendly bacteria. So probiotics. So there's a lot of new information coming out, and even the bypass surgery that's being done for people to lose weight. One of the side effects is because it's interfering with the microbiome or the friendly bacteria. That's one of the things they're trying to overcome now.
That's what they're doing. You mean that people who do bypass surgery?
They do bypass surgery for morbid obesity.
It affects that area also.
Yes, it affects the
So
friendly bacteria, or what we call the microbiome.
Okay.
And that's very, very important.
So the digestive system on a whole have a lot to do with over here, Major, the endocrine system.
Yes, of course. Yeah.
Right? Wonderful, because everything starts there. Now let me ask you another question. The endocrine system, yeah, and the kidney. I think we talked about it as the posterior part of the gland.
Yes, yeah, the
Right.
vasopressin.
Right. Now, you said when a person urinates a lot and have diabetes because that's
That insipidus.
insipidus. So,
Diabetes just means
insipidus.
passing a lot of urine.
Right.
Yeah.
No, when you pass a lot of urine, does the pancreas and the pituitary gland have a lot to do with the function of the kidney in terms of the water balance?
Yeah, well, the pancreas, by producing insulin, that's the endocrine part again.
Right.
Insulin and glucagon, well, those are very important in glucose metabolism. That's dealing with diabetes. Mellitus, which means the sugar diabetes. The insipidus, which is from the vasopressin, the posterior pituitary. That also, the vasopressin acts on the kidneys to retain water.
Right.
So if there's no vasopressin, the kidneys will just keep flushing out. They cannot retain the water.
Can't retain the water.
Because this is the treatment for that. We have to give vasopressin, either by nasal spray or injection.
Injection.
But as you mentioned, the kidney also is a endocrine gland.
Right.
It produces, angiotensin, converting enzymes, and so forth, and other
So
things.
it's part of the endocrine system to you.
Which, yes,
Right.
because the angiotensin and those things are important in dealing with between epinephrine and norepinephrine and other
I
things.
got you. Now,
So, and let me tell you, because a lot of people don't know, the biggest endocrine gland is fat stores.
fat stores.
Fat, that's the biggest endocrine gland.
Fat stores.
Because it produces leptin, LPTIN,
Okay.
which is what we call the satiety hormone,
Okay.
which tells you when you've had enough to eat. It acts on your brain, tell you you've had enough, on the hypothalamus, you've had enough. So people who have morbid obesity, there's a problem either in sensitivity to leptin, which is severe. These people are 800, 900 pounds.
Wow.
And people with other problems, because people can tell you that I eat it. Somebody as slim as you or myself probably may eat 10 times more than somebody who is obese. Again, leptin, for years I've been telling students and so forth, that leptin, that's where the medications to control obesity are going to be coming from. Even up to now, the things that they have are not there interfering, they're more like epinephrine type stuff, norepinephrine, which have too many side effects.
Wow.
So there's a lot of work going on in leptin, and that's where the answer is going to be in controlling in the future for controlling people with obesity.
Obesity.
Yeah.
Right. Look, let me ask you another question. The testicles. Because we know that the testicle depends on the prostate to have what we call sperm velocity.
to make it testosterone.
Right, the prostate and they work in conjunction.
Right, I understand.
But the testis,
Right, so we want
the
to
endocrine part
right. What
is
does
under control of
right.
the anterior and hypothalamus.
How important though is the pituitary gland and the hypothalamus gland in
to the testis?
testicles? Yes.
Yeah, just like we mentioned with the
What
ovaries.
the ovaries, same exact
Same,
principle,
exact same, except with testosterone and other.
which is produced by the gland,
By the testis,
by
yeah.
the testicles, right?
Mhm.
So the testicles depends on the endocrine system also.
Oh, it's a big part of the
All the
endocrine
time.
system.
Wonderful.
That's us. That's male.
All right. Now, when we were coming here, we were talking about type 1 diabetes. Over here, Major. Understanding type 1 diabetes, right? Now, type 1 diabetes is not diabetes, with mellitus, you said sugar, too much sugar.
Yeah, it's diabetes mellitus.
Right. But you said to me, or when we were driving up, you said that lots of your peers treat people with insulin when they're not supposed to be on insulin. Why is that?
Okay, type 1 diabetes, fortunately, and it's only probably 5% or less than of the total amount of people with diabetes mellitus. Type 2, that's the major problem. That's the epidemic problem, the type 2. That's the big problem.
Right, type 2.
Yeah.
Right.
But type 1 means that the body is not producing sufficient insulin. You need insulin. Without insulin, in a few days, a person with type 1, true type 1 diabetes will die. You catch me?
Okay, they will die. Oh.
But type 2 diabetes can produce, you need insulin too, but the insulin that's there is not functioning properly.
The insulin in type 1
2.
is not functioning properly.
No, in type 2.
In type 2,
Yeah, type 1 you do not have,
insulin at all.
right, or
Right.
you have very deficient in it. And without insulin, you will go in what we call ketoacidosis or
Coma, right.
Yes.
But let me
you
ask
can
you-
die
right.
without, if there's no insulin available.
Right, but let me ask you another question though. If there is insulin resistance,
That's part of the type 2.
right, that's what I'm saying. But if there is insulin resistance, and because I think I understood what you were saying, if the patient have insulin resistance, meaning that they're producing insulin,
Oh yeah, well,
right? But the doctors give them more insulin, not knowing that they're producing too much that they are producing insulin already. What happens to the body if there is too much insulin in the system?
okay, type 2 diabetes, which as I said is 95, 96, in the 2 3/4 years back in Grenada, I have not seen any true type 1 diabetic. I haven't seen a lot of people yet, but I have not seen a true type 1 diabetic, somebody who requires insulin to survive. Type 2, which is the epidemic with all the fast foods and lack of physical activity, there are 2 things cause type 2. One is insulin resistance.
Right.
Insulin resistance starts off first. When the person presents with insulin resistance, the beta cell of the pancreas, which we mentioned early on this side, produces insulin to compensate. By insulin resistance means, very simple, if you require 10 units of insulin to do the job, when you have insulin resistance, you need 20 units to do the same job as the 10.
I got
with
you.
somebody who does not have insulin
You need
resistance.
double of that.
Yes, it's sometimes a lot more. But I'm just trying to simplify it.
I understand that.
If the person continues eating the fast food, not exercising, the only thing they do is flipping the remote control. The beta cell of the pancreas over here, I'm going to say, to hell with it. I cannot compensate anymore. And then that person will get overt type 2 diabetes. This is why now we have something called pre-diabetes. With those people, all you have to do is 5 days a week, 30 minutes physical activity, and stay away from fast food, saturated fats. So if you only give somebody with type 2 diabetes insulin, you're going to be just loading them up with insulin.
Right.
Make them more susceptible to get an arteriosclerosis because
Right,
insulin
because hardening
will
arteries.
Exactly. But you're not dealing with the problems. I've seen those before because people will be taking 100 units in the morning, 100 in the evening, and the sugar is not controlled. You have to get at the insulin resistance, which metformin, pioglitazone, and other medications too. Unfortunately, the DPP-4, like Januvia, some people will know Januvia. They're expensive, but hopefully the patent will be launched soon. Pioglitazone is very cheap. I'm making a big difference in Grenada by prescribing Pio. Metformin, if used properly, is the cheapest medication, and metformin, I think I mentioned that to you before, has properties that prevent people from getting cancer if you already have breast cancer. Metformin prevents it from recurring and spreading. So metformin is sense for, for a pill.
Yeah, but I don't
supply, but you have to use metformin, pioglitazone to get at the insulin resistance.
Insulin resistance.
And if you don't do that, because my colleagues here are not using pioglitazone.
Oh, okay.
Okay?
They're not using them over here.
Metformin.
That's all they give everybody, metformin.
Yeah, and they use what we call sulfonylureas, Deonil, whatever the names. But you lose the effect with sulfonylureas 6 to 7 years of use.
Yeah, but even metformin too, I believe, because metformin called lactic acidosis. That's one of the side effects.
No, if you have type 1. You should never use metformin in a type 1. That's a person who doesn't have insulin.
Right.
You'll get lactic acidosis.
Lactic acidosis. It also it also causes anemia in people too. That's one of the side effects of it.
It has some, and if you're not taken in the middle of a meal, it can, cause the person to, to get upset stomach and diarrhea.
Right.
But believe me, Owen, it is probably one of the best medication ever made.
Or metformin.
But you have to use it properly, like everything else.
Right.
So the people, and you see, type 1 diabetes can present differently. In Caucasians, it presents, as a fulminant disease. You just present it with ketoacidosis. In people of African origin and other races, it can present with the beta cells slowly being destroyed. So, as you mentioned, lactic acidosis, which was proper. Metformin should not be used if you have a patient who comes into you and they're losing weight spontaneously, even though they may not be at a stage where they're full-blown type 1. They're on the road to being type 1.
Type 1 diabetes.
Somebody like that, I will never use metformin. Because metformin, one of the good things in people who are obese, it can cause them to lose weight. It decreases your appetite.
Right, and it could put you on insulin long term.
Right, but if you ask the patient, this is why it's important that you have to speak to the patient and examine them, and they've lost weight spontaneously. So you should not use metformin in those people.
At all. Now, what about insulin sensitivity? What about insulin sensitivity?
Okay, pioglitazone and metformin are called insulin sensitizers because what they do is they decrease the insulin resistance. So they improve insulin sensitivity. So those medications, the pioglitazone, well, that's the only one I was able to get in Grenada. There's another one, rosiglitazone, which is the same family. And as I mentioned, metformin. They're what we call insulin sensitizers. So they improve insulin sensitivity by decreasing insulin resistance.
Right. But the key to me, that's my opinion, the key to me to prevent diabetes on the whole, is to have a good diet and keep the endocrine system healthy.
Yes.
Would you agree with me on that?
Yes, physical activity and the proper diet.
And a proper diet.
Yes, and again, in Grenada and our folks in wherever in the diaspora,
the Caribbean full of that, full of starches.
They eat a lot of ground provisions, which has a lot of roughage, which is good. And I think 7 years ago, in a meeting in Berlin, they use, what's the stuff Europeans have, bran or something like that, which is not as good as our ground provision and bloggers, green banana and so forth. And they showed experimentally that using complex starches with a lot of fiber improves their own body's insulin function.
I believe that because complex carbohydrates do help the sugar to go up slow and come down a little faster, and that's a
Yeah,
fact.
the only thing as I tell people, pure sugar is no good. Cane sugar, molasses, brown sugar, white sugar, green sugar, no good because it gets absorbed too rapidly.
Too rapidly.
And the pancreas system that's already been confused, it causes more confusion.
Right.
So it makes stuff worse. You
Okay.
don't need to drink sodas and to, there are a lot of natural stuff.
Wonderful.
Honey and other things that sweet, but it does not
Push up the
have
sugar
pure
fast.
sugar.
All right, we're going to take a few questions from Dr. Sebastian Peters. If you want to ask him a few questions, he's right here. You could ask him anything you want to ask him. I think we have 5 more minutes. You could ask, especially if you want to talk, ask about PCOS and the reproductive system. Natural remedies. Somebody said what? This is full of what? Pharmacology? Want to know about natural treatment? Well, that's a doctor perspective, but as I said before, Dr. Sebastian Peters do send patients to me also that he feels need help naturally. As I said, I don't want to fight on anybody's business, but at the end of the day, sometimes, herbs do not control a person's sugar level as it's supposed to. So sometimes what I do, I will keep the person on their medication while we try to repair the pancreas naturally. So to answer your question is, he's a doctor, he knows nothing about plants, so he cannot prescribe herbs. That is common sense. So that's the reason why he will send people to me on a regular basis that he know will need natural treatment to help them with the diabetes and other problems, okay? But he cannot prescribe drugs, herbs, because he's not a herbalist. So he's talking from his perspective. All right, we have our perspective also. But at the end of the day, we all work together. That's the bottom line. Let's go over here now, brother. Okay. Yeah. So all right, Major. You can't expect us to talk from a herbal perspective all the time. Doctors talk from the pharmacology perspective. He's just telling you what drugs that they use to control diabetes when you have insulin resistance. I'm telling you herbs you can use to do that. So I'm not going to fight against his terminology because that's what he knows. That's what people doesn't understand. We don't want to fight on each other. That's his way. He was not trained in herbal medicine to prescribe herbs. I was not trained in pharmaceuticals to prescribe a pharmaceutical drug. But that's his way. That's what he knows. So he can't come and take gentian and Jimmy Sylvester because he doesn't know these plants. So he must go on that route. You know what I mean? But he is trained in the endocrine system, and sometimes you need to be on some pharmaceuticals. They could call me a commercial, not their business. Sometimes I don't take my patients off of certain drugs because sometimes the problem is so chronic that you have to keep the person on certain medication before you can balance back the system and have the person wean themselves off. That's what we call real medicine. You know what I mean? Not just saying, well, come off the drugs, come off the herbs, don't take herbs, don't take drugs. It's not about that, man. It's about complementing each other.
I need you to remind them that the majority of medications came from herbs.
Yeah.
So
I want to tell them that.
the majority of medications, so we're not here to fight one another.
No, man.
But
Nah.
to combine, the bottom line is for the better health of the patient, the community, whichever country, and humanity.
Yeah, that's what it's all
And
about.
you live a better life. When patients come to me, and a few weeks ago I did something on the radio on menopause. I told there are herbal things that you can use, like red clover, but I tell people don't go outside and in their yard and grenade and try to pick it. I told them go to Patrick Delps, he can identify stuff. The people with the prostate, I tell them about the kojo root weed and so forth.
And the guinea hen
I
weed.
said guinea hen weed,
Yeah.
which you can get in Jamaica, or Jamaican brothers and sisters are like years ahead.
Yeah.
They know how to deal, and they have guinea hen weed tea bags.
Yeah.
That's available
You can use.
and worldwide now. But so it's not that we fight him with
No.
combine. I send people to him, I tell them, you don't go in your yard and try to dig up something. Speak to Patrick, he's the expert, he can guide you on it.
Right.
So we're not fighting, we're
Yeah.
working together for the better health of the
Of the
community.
people. Yeah, because if I had a patient come to me last week, and this patient had a pituitary tumor. You know, come on, man. Herbs don't work in the area. I have to send him to an endocrinologist. So I had to send that patient to Dr. Sebastian Peter because his lip was big, his hand is big, swell. A young guy, 21 years old, have big hands, big lip. They took the tumor out, came back. You know what I mean? Now, if a drug can keep the tumor from getting bigger and prevent the brother from not losing his eyesight, you think I'm gonna come and tell him, take some red clover and take some chaparral and take some thyme and take, I would do that. Because his survival is at stake. So I will tell him, yeah, you could take the inflammatory drug that will keep the tumor down, but at the end of the day, you have to look to change your diet to see what's going to help in terms of keeping the tumor from coming back or shrinking. You know, so it's what we call complementary medicine. That's what it is. See? Because if a person have a tumor in his brain, of 5.6 centimeters, you tell me you go to a herbalist, how the hell the herbalist going to treat the tumor in your brain? And that's why a surgeon is a great man. Because the surgeon, man, he ain't know nothing about no plans, but he could go into your brain and remove the tumor. And then you could come to a herbalist if he knows what he's doing, and you can prevent the tumor from coming back. But the herbalist can't go into your brain. And if you have inflammation, or you have water in the brain, you name me some herbs that will remove the water out of your brain. You have to go to a surgeon to remove the water out. Am I speaking the truth, sir? It's bottom line.
Perfect.
You know, so you know, when people have to know.
It's not adversarial. That's
Yeah,
it's not either
not
or.
adversary stuff. It's about
Complementary.
Yeah, it's about the patient's health and keeping the patient healthy and making them well. Even though it's going to take some pharmaceutical, it's going to take some herbs, it's going to take some homeopathic medicine, acupuncture. That's what I will. That's what I will deal with. So when I have patients that need medical attention, especially troubles in the pituitary gland, this is the gentleman I send them to. If a patient come to me and they have heart problems and they have a failing heart, who do you think I send them to? Patrick Dallas? I send them to Daigo Humphrey, my nephew who's a cardiologist. He's trained in the heart. But I try to teach him about herbs that could work in conjunction with the medication he's prescribing to the patient to keep the patient health from getting worse. So it's called complementary medicine. Don't forget that. All right? Any question there, Major, for Dr. Sebastian Peters?
No question.
You got to go. Yes, you got to go. This man is a busy man. Let me see where. All right. Turmeric. Well, Dr. Sebastian Peters, turmeric. He's not a herbalist. He's a doctor. Yeah, but
use
yes. All right, we have to go now because Dr. Sebastian Peters has to go. You have some appointments. But I want to thank you for coming, Dr. Sebastian Peters. Again, your email is SAMAXE at AOL. SAMAXE at AOL.com. That is Dr. Sebastian Peters' email. If you want to talk to him and send him an email, you could do that for him. Do that to him, and then we could do from there. Okay. Thank you for coming, sir. And I hope you all got good information about the endocrine system, how they work, because there's lots more things to learn. All right? And I want to thank the doctor for coming by. And I hope that eventually that people can learn how to take care of the endocrine system, and women especially, how to take care of the reproductive system and prevent you all from getting PCOS and growths in your reproductive way. They have to pull it out. So until, give thanks and praise to the Most High. And don't forget, I'll be in New York on the 21st of May, which is Sunday. And from Monday, you can call 718-469-0985 for appointment, because I'm only there for 10 days and I'm going straight to Canada. All right? So until, bless and love and give thanks and praise to the Most High. Bless you.
Good man, yeah. A lot of you folks wanted like adversarial stuff.
Yeah.
Particularly for some cold water, please.
Sure. Good. I'll take some cold. I'll show you guys.